Good morning. I'm Lawrence Obstfeld, the CEO of Image Navigation. Okay. We have developed IGI, a GPS for dental implantology. When we look at navigation in robotics, we see that it's really progressed from its introduction in medical, ENT, neurology back in the 90s over the last 30 years, and the penetration rate in dentistry today is much lower. This is our entry, IGI. The components of IGI are, where are you guys seeing my slides? Over there, okay. Okay. On the upper left, you see our intelligent drill. Beneath that, mini lock that synchronizes the patient to the CT scan. The dentist is looking on screen at the intrabony position of the drill superimposed onto the CT scan. We consider that dentists have sufficient perceptual motor skills, acuity in their hands to accurately place implants, and that the barrier is one of visualization. And then we see our cart and camera. So the three main pain points for adoption of navigation in implantology are: one, the patient's moving. We had one dentist talk to us. He said, Mike Tyson is going to be my patient next week for an implant. Will this help? Because he's always moving around. Second, synchronizing the patient to the CT scan, because you can't take an intraoperative CT. And third, all the small space working challenges. We handle patient movement with an intelligent drill with spatial awareness. It's at our booth. And we have here 14 LEDs that blink light at the speed of light, and there's no video pattern that needs to be interpolated. And we know where the position of the tip of the drill is to 250 microns, 40 times a second. We update the on-screen 10 times a second. So you can see that our update rate here, IGI on the left, 10 times a second. That's better than even Gamer's Seek, which is 7.5 times per second. And our competition seems to be in the area of 2.5 to 3.5 times per second, which is fine for orthopedics when the patient is not moving, but you guys have moving patients. It's not enough just to track the tip of the drill and know where it is. You have to accurately superimpose it onto the CT scan in exactly the same place. And we match this patient in your chair to the patient digitally in the CT scan to an accuracy of 100 microns, 1/10 of a millimeter. And we do that utilizing mini lock. And this means you can take an image of the patient, you can come back 2 weeks later for surgery, and it is so well fixed to the patient that 2 hours you don't need to look at the screen. You don't need to look in the oral cavity. You can look on the screen. This is good for your physical health. We have best-in-class accuracy, better than 1 millimeter. Now, that gets magnified because you're looking where the drill could be in 3 dimensions. So the sphere is much smaller when you have accuracy of better than 1 millimeter. You don't have the pi r cubed effect. We combine the accuracy and the real-time feedback to this robotic auto stop. So you'll see in this simulation when the drill goes offline, it turns red. Now back online, the drill starts turning. Now we're going to cut to an actual surgery. When the angulation indicator becomes red, you set it at 2 or 4 degrees, the drill stops almost immediately. And when you arrive to target depth again, the drill stops. I'll share with you a few cases. This is a full arch case in the aesthetic zone, and you can see how the implants are placed in the nasal bone. Same case. And you'll notice here that the implants are placed near the alveolar nerve, because the longer you use IGI, the more you realize it's completely dependable. This is also a Dr. Frumovich. Dr. Giakis in Greece is using IGI for many pterygoid implants, where a drill guide, lifting a flap won't allow you to see the site, but with IGI you can see the apex of the drill. So now this pterygoid implant surgery. On the left, you have the mini lock, which is synchronizing the patient to the CT scan. See here, the implant passes very close to a very low sinus. Two different slices showing the planned implant location. The doctor's measuring the burr now by touching it. And if I direct your attention to the lower right, we see the pathway of the drill inside the planned location. These are several of the doctors that are working with us. We have MDR approval. We're commercializing in Europe. We will be in the United States. The cases that are needed for our FDA approval have been done. We're applying to the FDA for 510K approval, which we'll have later this year. We're raising another round of capital. Glad to speak to investors and glad to talk to individuals who would like to be early users. Time for one question? Okay.